you over the last couple of weeks when the state of Texas was not sure if they were even going to collect data on the COVID cases in the state of Texas. Since then, based on work done here in Austin by great reporting, thank you for all that you're doing, and our pushes as well to say that we would do our own system if the state wouldn't. They've at least come up with some plan now to start tracking that data. However, there's some very significant differences between what they're doing and what we're doing, and we're going to walk through those today. So stay tuned for those pieces, and we'll look forward to questions from the media after we've had an opportunity to do our presentation. With that being said, I would like to turn it over to President Weingarten to give us the perspective also from the national level, because this is work not just happening in Texas, but happening across our country. President Weingarten, thank you.
Thank you, Zeph. And I'm very excited and grateful that the Texas Federation is, has worked to develop this tracker with your allies and partners. I'm very excited to hear from Catherine shortly. This is first in class kind of work that the Texas Federation is doing, and it comes at a very absolutely imperative time. We have, as Zeph knows, we had a call yesterday with all of our state federation presidents, and you could see a tale of two countries. One country whose elected leadership, actually believes that there was and is a pandemic, the most viral and dangerous pandemic that we've had in 100 years in terms of COVID, and that has to be taken seriously. And we're learning new things all the time, including the amount of asymptomatic spread, the fact that children are affected, that even in the new Bob Woodward book, Trump acknowledges, even though publicly he is not. And so you have a part of a country that has actually taken it seriously and understands that this tracking and tracing is a very, very important way of containing disease and preventing more disease, in the absence of effective therapeutics and in the absence of a vaccine. And then you have another country that has politicized this and doesn't think about this as a public health disease and something that's really going to hurt people, and sees kids and teachers and meatpacking employees and others as expendable. And so unfortunately what has happened in Texas is part of that second country, the country that sees this as politically, not as a health and safety issue. And therefore, what we have to do is we have to be the ones that make sure that there's transparency. We have to be the ones that make sure that people are safe. We have to be the ones that push back on this unconscionable pitting of learning versus life. Our kids and our educators' lives are really important. They are not dispensable. They are not expendable. And so this tracking and tracing, as well as ultimately the fight around testing to make sure that we are medically monitoring what is a very much of a terrible and dangerous asymptomatic spread, is really important. And so I'm very, very, very grateful that you have, that you're announcing this today, and that you are doing what union's role is, which is in the protecting of people's lives and the protecting of our health and safety, and starting by doing it with the transparency that the government should be doing and isn't. I'll do just a comparison. Governor Cuomo in New York has put this kind of dashboard in place in New York. That's what Governor Abbott should have been doing. That's what Governor DeSantis should be doing. But instead, there is a lot of non-disclosure, including, for example, in Florida, where they are actively covering up cases. We need to make sure that people know. We have to have something that says, right now what we're seeing is when government officials see something, they say nothing. What we need is everybody to take responsibility. And when you see something, we need to say something. And that is what this tracker is about. And I'm very, very grateful as a national union that wants to protect people's lives, that wants to make sure that health impacts are as great as we can make them, that wants to make sure that we take care of our kids and take care of our members. Thank you very much for doing this.
Thank you, Randy. Appreciate the support. And so before we turn it over to really walk through the system, I wanted to go over some of the reasons why we felt this was important as an organization and as a group who represents more than 65,000 educators across the country, as well as the students and families that they work for and work with. First, I think most of you are aware that far too many of our teachers and parents have not been included at the highest levels that they should be, or are even at any level in some of our school districts in the planning for and the COVID response and the reopening of their schools. So first and foremost, one of the big differences that you'll see between our tracker and what the state is doing is that this is going to allow for direct interaction from, by, and with our teachers, our support staff, our employees, our parents, and others, that they will be able to interact directly with this and take some level of control for helping to keep up with the identified cases across their campuses and across their communities. The second major piece about this as well too is we're really unsure how the state is going to deliver their data. What we're hearing right now is that districts are going to deliver that. The employees that are directly impacted, or the families and the parents that are directly impacted, may not have a direct voice in that, but they may also not report at a campus-based level. Well, if they're only reporting at the district level, for districts like Houston and Dallas and San Antonio and Austin, those are very large districts that cover an extremely high level of geography. What good does that do parents and family members if they don't have the information about what's happening in their neighborhood and in their particular school? And that's why we've prioritized making sure that we have our system available to cover every public school in the state of Texas. Third, one of the major problems that we've seen is there's a lack of a plan for testing in our public schools. One of the things that we hope by beginning accurate information that we can make sure that is updated in real time, that is properly validated and is available to the public, we will at least be able to get some step on the tracking side moving forward, so that we will be able to gather the data to really support our position that school districts in particular need to have a plan for testing. They need to be testing employees that are coming down with this virus before they're coming back in. They need to be testing for the asymptomatic carriers that could be spreading the disease within our schools and we're not aware of it. There has to be some level of plan that goes beyond just a temperature check, because we know, particularly with students, far more of them are going to be asymptomatic and they're not going to register a temperature. They're not going to have necessarily those signs as well too. So we're going to have to figure out a better way to move forward. We're looking at the plans in Los Angeles and Detroit and other places where they are coming up with different ways to ensure that testing then is tied to the tracking systems that are put in place. And that's why this is important. These are some of the things that we think are going to be very different than what the state is doing, and why we are invested in making sure that everyone, our members, their colleagues, and the parents and families that we represent have direct access to the information. So without further ado, I'd like to turn the platform over to our partners with the United for Respect. We have with us today their Chief Technology Officer, Catherine Huang, who will be walking us through the tracker and how it works. Catherine?
Good morning, everyone. Thank you, Zeph. As Zeph mentioned, I'm the Chief Technology Officer at United for Respect, where we built a COVID-19 tracking tool for more than the 2 million people who work at Walmart and Amazon distribution warehouses across the country. We built the tool so that our essential workforce could quickly exchange information about cases, conditions, and closures to keep each other safe and informed during the pandemic. So I'm going to take a couple of minutes to walk you through how we're using the same technology on behalf of AFT to support teachers, school employees, and the community in Texas. I'm going to share my screen. You should all be able to see my screen now. As Zeph shared, the tracker is a web-based tool, and it's available at stopthespreadtx.school. There are two primary interfaces to the tool. There is a map interface with pinned locations indicating activity. An activity can mean one of two things. It is either a user-submitted report at that school site, or it is what we call externally validated information about a case or a positive case or a death. And those externally validated information can come from news articles, the district itself or the superintendent, or school sites, the principals themselves. So you'll notice that we don't actually show any a pin for all of the school sites. We have over 8,000 sites on the backend database. It's only where we have some kind of activity for that site. On the right-hand side, you'll see we're right now sort of in beta. So it's not, I might be toggling back and forth from what's called our QA site. On the right-hand side, you will see that it's a list of user reports. And this is our crowdsourced data. And this is sorted by the most recent submission. And each card essentially shows you some top line information. It shows you the number of cases submitted in that user report, how the person found out, and when they found out. You can click on any card and see more information about that location. In this case, this location has one positive case that was reported by KXAN. And if you click through, you can see the article itself. Or you can engage directly with the union by a call to action. In this case, it's signing a petition. You can connect directly with the union, or you can engage and interact with other members of the community by leaving comments about what's going on at the school site and get into a little bit of a dialogue. Going back to the main interface, there's a couple of different ways that you can sort the information that you're seeing. There's the ability to search specific school sites, either by district or by school name, by this search bar here. And so if you type in the district, you'll see a list of all the school sites in that district. And in this case, they actually don't have any activity at that site. So no pin shows up. Or you can use filters. And so we allow filters by district. There's a list of districts here. We also allow filters by incidents or reports. Reports are essentially what is crowdsourced information, and we take three types of reports. It's either a COVID-19 report, a safety report, or a story report, and I'll go into those in a minute. Incident types are what I mentioned before. These are externally validated pieces of information that can be either news directly from the district or the school sites. So these are confirmed positive cases or deaths at specific locations. So I'm going to go back to reports. As I mentioned before, we take three different reports. Users can file a COVID-19 report or a safety report. And a safety report is essentially used to gather information about specific school site conditions. So that can range from temperature checks to social distancing to what the cleaning and sanitation looks like at that site. But it's just a way for us to get sort of more information about specific school sites that might not be related to a positive COVID-19 case. And the last type of report is what we call a story report. And that's really for us to be able to understand what people's experiences are of working during a pandemic. So I'm going to take you through the COVID-19 report. We ask in the previous screen, there's 3 total screens, but 2 primary screens. But in the previous screen, we ask you what school site the report is for. And this is sort of the meat of this form. So we ask you how many cases you're reporting for this work site. What is the source of your information? It can be the district, the school site itself, a peer, a report for yourself, a news link, or somebody from the community. And I just want to note that if it is, if the source is the school site, the district, or news, then we encourage you to add a little bit more information to help us validate and change the crowdsourced data into a positive case. In this case, we also ask you when you found out. If the school has been closed, we ask you about the mask mandate that the governor announced in early July and how that policy is affecting your workplace, and then anything else you want people to know about. We also ask you to verify that the information is correct, and then we also ask for permission to share it publicly. And that's pretty much it. The next screen is an optional screen to provide your contact information for a follow-up, but the whole site is really meant to be very straightforward and an easy to use tool that educators can use to make informed decisions about their safety, their family safety, and their community safety. It also gives us, as Zeph mentioned, a real-time interface to see what's happening across the states as schools are reopening during the pandemic. That's it for me. I'll pass it back to you, Zeph.
Thank you very much, Catherine. And, you know, as you can see, in addition to just the COVID-19 actual reports, many of those dots have been filled from your stories where we have collected them across the state. But we also have the ability for our members to put in those safety reports and tell what's happening on those campuses. That's a very important tool to us. If you'll recall, or many of you may be aware, that our local in Cypress Fairbanks literally had to go to the point of filing a lawsuit to get their district to take some of their deep concerns about the lack of PPE, the lack of social distancing, the lack of, frankly, you know, giving the level of importance to people's safety, the respect that it deserved. We hope that this tool will help us identify those areas of concern, identify those schools quickly and early and at the lowest level, so those types of actions don't become necessary anymore. There have been multiple, over the last couple of weeks, multiple cases where we've had to intervene, some of them in school districts where there was simply a lack of communication, information not getting from the superintendent's office down to the campus level, or, you know, PPE not getting distributed at the rank and file teacher and support staff level, where we've been able to fix it and we've been able to get that moving. Bus drivers get their gloves, they get their masks, teachers and support staff get the hand sanitizers that they need and the cleaning supplies to make sure that their rooms are safe. There have been other places where we've had to work much harder. It wasn't just about communication, but about not having the supplies readily available or not properly planning. So hopefully what this will do is give us an opportunity to vet those pieces out and make sure that we're keeping as many people, both our employees and the families they serve, as safe as possible. So I think that at this point, we'd like to take a few minutes and open up the floor for questions, either for myself or for Catherine, particularly on the direct use of the tool from anyone in the media. And I think, yes, Rob has actually put the website link into the chat so that you're able to copy that piece out and move it forward.
And I'll post a full release momentarily as well, but everyone should be able to unmute yourself So if you have any questions, let us know.
Hi, Zeph. Good morning. Sophia from NBC in Dallas. Actually used to be at KPRC, so I've talked to you multiple times back in Houston.
Yes, ma'am.
But question for you. So when it comes to just holding people accountable, meaning let's say somebody has a vendetta and they put false information, is there a way to vet that so that doesn't happen?
That's a great question. First and foremost, we saw earlier, they're required to certify that the information is true and correct. And we understand that that is, frankly, only as good as somebody is willing to give it their word. But if you recall, there were a couple of other spots where we're looking for actual data, actual information to back that up. And it could be a news article that came through that maybe we've missed. It could be a letter that they've received from HR or their principal that is notifying them that there was a positive case on their particular campus and what have you. So generally, we're looking for that type of confirmation. We really want a letter from the principal, that letter from the school district, the third-party validation as much as possible. And then we have to make a decision on whether that case is published. If for some reason we feel like there are cases that are not validated or maybe give us some hesitation or pause as to whether they are valid or not, because somebody may have that grudge, we have the ability to not publish them or unpublish those cases as they come through. And so we definitely have a back-end system that's working on that and looking for that validation. This is also is important so that we're not duplicating the cases that may get turned in. For example, if staff of 100 people receive the same letter from their principal, we'll be looking at that evidence to say, okay, what's the date on this letter? Is this the same as the case that was reported earlier this morning? If that's the case and the evidence points to this being the same incident, then we would only be reporting the one incident on the published site. And that's really important too, because you could have different incidents on the same campus over a period of time. We want to make sure that we can discern between the two.
Could you clarify for us the turnaround time on those reports? I would imagine it takes some time to review those materials that you're just talking about and verify that some of that information is not duplicating. What's the turnaround time on from when I press report to when it shows up on the site?
Sure. And I think, Wes, I think part of that is going to be very determined on it when we have staff that are there watching it. But Catherine, if you could correct me if I'm wrong, when we were walking through the process of going through this and we had staff putting in a system that we were seeing, putting in a report we were seeing live, it maybe took about 5 to 6 minutes to go through the process on the back end, review that was going through there, making sure that the evidence was updated. It really doesn't take that long if you're actually there monitoring the system at that moment. What I would say is I can't necessarily guarantee that we'll have staff monitoring every moment of the day, but we will certainly be staffing it to the point where if cases come in that morning, they should be up and validated within the few hours that they've come in, so that we've got regular check-in intervals for people to process those cases as they come in within a 3-hour span.
Yeah, just to add, there's sort of 2 buckets of data. There is the crowdsourced user submitted data that as soon as someone submits it, other than sort of the validating information, if they submit a photo, as soon as they submit the actual report in terms of the number of cases and any additional information and how they found out and when they found out, that shows up instantly on the site. Then, as Zeph mentioned, there's another pool of data, which is the positive confirmed cases by school site. So that basically has the same workflow and the same timeline that Zeph just outlined. So it could be as close as 5 minutes and it could be within 3 hours. So it's all the back end sort of staff who goes in and makes sure that the information is not only valid, but that it is sanitized. So it doesn't actually have any personally identifying information on behalf of the person who submitted it.
Thank you for
Zeph,
that
I know
question.
this is new, but what's the feedback that you've received from educators about this site and even the idea to do something like this?
Very, very interested. We have a group of statewide digital and social media members that have been working with us, and bringing forward information that they hear from the field about people's concerns. And frankly, they were all over this when we brought this to them to really get their advice on should we pursue this and should we move this forward. I think the feeling was we couldn't get it out fast enough. They wanted to make sure that you know, there's been so many of our educators that have not felt like they've had enough of a direct voice in how what decisions are being made. I think this is and that feeling in and of itself, if you could imagine, where you're starting to feel a bit helpless or starting to feel like you don't have control over your own personal health and safety. That can be a bit discerning. I think one of the things that many people were feeling that is this tracker will be an opportunity for them to take some of that back, to have more of a direct ability to be able to control their health and safety and be able to speak out about it, to make sure that the information is transparent and is getting to where it needs to, so that everybody can make the best decisions for themselves. We're also going to be doing a rollout with all of our local presidents. One of the pieces, or one of the tools for us, is where we have an established local in the state, they will have their own landing page that specifically drills into the campuses within their district. So for example, all of the major urban districts in the state will have their own page that focuses in on their work locations that we will be driving the members and employees and parents in that area or that district to. They're directly connected, but they'll see it a bit more personalized to their experience. So we hope that that also leads to giving them a bit more control over their environment, over the decisions that are being made about their health on a day-to-day basis as we reopen more schools across the state.
Hi, this is Lydia from Fox 4 in Dallas. I don't have a question specifically to the dashboard, but I was wondering if teachers don't feel safe coming back to school, is there any guidance from the TEA right now on how to handle that? Like, are teachers able to apply for some kind of medical waiver for them to teach from home?
They certainly do have a couple of choices and options. If they have specific health issues that are directly related to themselves personally, then they should be able to apply for an Americans with Disabilities Act accommodation request, an ADA accommodation request, to be able to teach virtually. And we've seen many of our members that are currently going through cancer treatment, may you know, have an immune deficiency disease that they're working with. They may have on dialysis or some other type of acute medical treatment that they're working through. Many of them have been applying and have been getting approved for virtual leave. The concern, I think, is that you don't have those same rights if you are living with a family member who's in that those type of circumstances, for example. The option that they would then have would simply be to be able to take a family medical leave, which may not necessarily be paid. FMLA is not paid unless the employee has sick leave time that they can utilize to do that. And that's when the decision starts to become a bit tougher, particularly for many of our members who are the primary wage earners in their home. But yes, they do have a couple of options. They may be somewhat limited and somewhat based on their circumstances, but they do have options, and we are working with them on a case-by-case basis for our members that bring them forward.
I have another question just on the point of verifying the reports that you're getting. I'm wondering whether even just internally on the back end and not for public consumption, there will be any collecting of names. So for example, if I say I'm a teacher at X high school, you could at least verify that I am who I say I am and I work where I work to check on that before sharing that concern publicly. Is that something that will be used at all names and also in terms of avoiding double counting cases?
Right. So I think that some of this, Emma, is going to be judgment, and we're going to do our best to make sure that that doesn't happen. The cases are anonymous. However, the reports are anonymous initially. The page that Catherine was referencing that follows the submission of the report does give the reporting individual the opportunity for follow-up and feedback. They can provide their own name. We would encourage them to do so, and we hope the more they interact with the tool and the more trust that they build in us to maintain some level of their confidentiality, more individuals will choose to actually leave their name because they'll want follow-up from us and they'll want to be included in what we're doing to try to make things safer on the campus. So that definitely will help validate information because, yes, you're exactly right. We can then identify them by going on the school's website, checking the faculty directory, ensuring that they are actually an employee that works there. But we also don't want to necessarily withhold information that may come from a parent. We may not have as much direct ability to be able to verify if it's a parent that is turning in that information. And we will certainly be able to note those things in the record on the back end of it as well. We certainly will be paying attention to markers to do our very best to ensure that we're not duplicating cases, but we're going to also be very transparent about it, that there may be some of that happens, but we by far do not believe that the data will we don't believe that there will be so much of that the data can't be trusted enough to make informed decisions by the people that are working in those campuses.
Are you encouraging students to participate in this as well? Is there I guess an age limit to a minimum age to submit on the site?
So there's definitely not going to be any way that we could control an age limit with an anonymous report. Again, I think that you're going to have some varying levels of validation that are going to happen. Obviously, when reports are going to be completely anonymous, we're going to be relying more on some type of physical data to back that up. Was there a letter? Is there some type of media report? Is there some third-party witness, etc.? That is going to at least give us an opportunity to check that out. I would assume that students at the high school level and others would certainly be able to access because the website will be publicly presented. They'll certainly be able to access it, but quite frankly, it's been our high school students that have been one of the first to be those that call people in the community to action. It's been our students that have been taking the videos. It's been our students that have been showing where social distancing and other safety measures haven't been practiced on their particular campus, and their voice is very important.
Okay, and any other questions? Also, this is Rob D'Amico, the communications director. Just note that I posted the website and a full link to the full release in the chat. Randy is with us as well. If you have anything else to say, first, but any more questions? Okay.
Well, thank you very much for coming in today to see how our system is working. We encourage you to follow up with us after this period at any time. I'm available publicly, most of the time. I try to get to as many calls as possible. And we certainly can also do follow-up with our partners from United for Respect, and obviously the assistance that we're getting from our national organization, AFT, to be able to connect the dots across states where we are seeing similar circumstances happen. Thank you for joining us today, and we look forward to speaking with you soon. Have a good day.
Will Dupree, once again here in the KXAN Live studio. That just wrapped up a virtual news conference, obviously from the Texas American Federation of Teachers Union here in our state. They are launching, with help of a group called United for Respect, a tracking tool to keep record of COVID-19 cases and reports and working conditions and even deaths in public schools here in the state, because there is nothing at the moment that allows parents, families, students out there, as well as staff members who are in our schools, to be able to keep up with that information. So I want to show you all the website really quickly if you'd like to check it out. This is what it is. It is, here we go, stopthespreadtx.school, and it's right there at the top. Stopthespreadtx.school. It's officially launched. This again is from the Texas American Federation of Teachers, launching it today. And if you see this map, there are already reports that have been shared out there. So what they will do is they will crowdsource sometimes these particular reports of COVID-19 cases, and they will work to confirm those before they put them on the map so that people can go and search for certain school districts or by specific schools, and all that information will be compiled here. What we will say is that the Texas Education Agency and the Texas Department of State Health Services announced last month that they will be putting out some sort of tracking tool to share information about cases of COVID-19 and deaths related to that in some kind of dashboard form. However, that was last month. There has been no mention, no sharing of any kind of tool of that sort at this point. So we'll keep asking about that as well. But in the meantime, this teachers union is stepping in to be able to put this information out for people out there. You may have seen our reporter, Wes Rappaport, joining there to ask a couple of questions of the officials from this teachers union. He will be doing a story about this, so you can keep up with us here on KXAN as he turns that for today for our evening newscast. And he'll be updating our web story as well on KXAN.com and on the KXAN News app. For now, I'm Will Dupree here in the KXAN Live studio. We'll see you back here another time. Please, everyone, stay safe and stay healthy. Take care.